Hello everyone and welcome back to the Diary of an Endodontist. So, have you ever had problems finding the MB2 when you can't find the pulp chamber because it's all calcified, you don't feel that fall? So yeah, there are some tips and tricks that I'm going to share with you. First of all, if you have the opportunity to take a CBCT, the CBCT is the map, the road map, where it shows where the canals are, where the pulp chamber is, how wide the pulp chamber is, how wide the canals are, and also how many canals and if the root is inside of the sinus or not. So that is good if you have all that information, if the root is curved, the tooth is inclined, for you to do your access cavity in the best position ever. Once you do the access cavity, it's time for you to locate the canals, and sometimes the canals are quite narrow, and one advice is follow the lines in the pulp floor. If you are getting a bit more lighter, it's because you are going out of the pulp chamber, so make sure you don't carry on drilling that, otherwise you are going to perforate. The pulp chamber is normally slightly darker, and you have some lines that can guide you where the canals are. At the end of those lines, that's where the canals are. A bit calcified, you can use the Allen bar if you want to. I quite like that because it helps me drill a millimeter or two just to have the orifice exposed for me to catch my file and try to scout that canal. For you to scout that canal, use the Flexo file 10. That is the best file, either K file or Flexo file, but pay attention on the distortion. If you have distortion, don't carry on with that file because that file is going to break. So that's the file shouting for help, saying, don't use me anymore. So check in the bin and move on with another file. Another thing that you can use, and it was used in that case and it's quite nice, is the true anatomy. I've liked that very much. You have the orifice opener, and then you have the glider and the main file, the 25. So you can use the sequence to help you locate the canals, enlarge the coronal third, and then move on and try to reach, once you have your working length determined by your apex locator, you can use the glider, and you have now your mini preparation. So with the mini preparation is easy because now the next file, which is the 25, there is not much work to be done because the file, the glider, did it for you. Don't forget to do patency. So patency is always working length plus one. So make sure you do the patency, and then you can move on to your final prepping file. My advice when you have the MB2 that I could see on the CBCT, but always search for it anyway, because more and more we are finding in the upper molars, mainly the first molars, but it's possible to find on the second, it's possible to find on the third. So make sure you search for it. But don't prepare the MB2 yet. Prepare the full MB1. It's a lot easier and you have less trouble when you prepare the MB1 first. Once that is prepared, then you can move on and try to locate the MB2. Where is it located? Slightly few millimeters palatally to that MB1 and few millimeters mesially to that MB1. That's where you are going to find that canal. So it's not there, it's there. So when you saw that line, the kind of an isthmus, it looked like it was there, but no, always drill 2 millimeters away of that. And sometimes you need to go a little bit deeper to find it, millimeters as well, deeper, so you can find that canal. Once you find that, it's time for you to obturate. So if you go back and see the preparation and now the obturation, don't forget to use plenty of irrigation, alternating at the very end the sodium hypochlorite, EDTA, and sodium hypochlorite. Make sure the pulp chamber is always full and always flush a lot. And you can use the new endo activator. I really like that. That comes with the light cure as well, so it's very good. So that is plenty and it flushes everything out. And once that is all clean, then you can dry your canal, GP point, and the bioceramic sealer. So canal is prepared and it's all done, and you can see now the views. That is the mesial access cavity, quite small. So you can see here the MB1, MB2, distal canal, and palatal canal. You can't have all of them in the same view because the prep is quite conservative, but not as conservative that you can't find them. So make sure there is a common sense and that how much you access that tooth. And everything is done and obturated nicely. It's time for you to bond the composite. And please, if you have the opportunity, make sure you put composite in the tooth. Forget about this RIM and cavity, PTFE. No, because that expands, it can put pressure on the tooth fractures, the patient disappears. Don't go for a crown. So make sure you bond that properly. You've done all of your work and you don't want to compromise your work at all. So you want to save that tooth, so better to think about preparing that cavity, disinfecting it, filling, put a permanent fill, put a permanent composite, and now time to refer back to your dentist, the referring dentist, to put a nice crown. I hope you have enjoyed that, and I hope you can use some tips and tricks for your next case. Take care.